Viewers, welcome back this morning to the Tobago Updates Morning Show. We're chatting this morning with Dr. Faith B. Yisreal, Secretary for the Division of Health, Wellness and Social Protection. This morning, viewers, we are concentrating on the COVID-19 cases that may be on the rise, as well as the OPR Whistleblower platform. We're going to discuss that a little bit later on in the program. Dr. Faith B. Yisreal, good morning and welcome.
Good morning. Thank you for having me. It's wonderful being here. Bright and sunny Monday morning, is it?
Yes. I'm so sorry that we had to get you out of your bed so early. I know you're not a morning person.
But you know, being in this position, I have started actually having 7 a.m. meetings. For me is a norm now.
Wow.
Yes.
Kudos to you.
My staff don't appreciate it, but at least it's on Zoom.
Okay.
Yeah, at
That
least
we
it's
can
on
deal
Zoom.
with.
Yeah.
That we're comfortable with. All right, let's chat this morning about. No, we're hearing in the news that COVID-19 cases are on the rise. How much of a rise are we talking about being on the rise?
So in the United States, and I guess if we're looking because we focus on US news, there is an uptick. If you really listen to them carefully, that is the word they use, an uptick in COVID-19 cases and a few hospitalization in the United States. It isn't just something that we should be too concerned about. We are seeing a slight uptick in Trinidad, but we have not actually seen any uptick in Tobago, possibly because it is so mild. There are cases. We never said there would be no cases, but the cases that are there are so mild that people are not coming to the hospital or health centers to be tested. So the official reported numbers are very, very low. And of course, this is a time that we normally have cold and flu season. So everybody have a cough, everybody have a sniffle, everybody has that kind of symptom. So unless those individuals are so ill that they feel they need to go to the hospital, it is really not being picked up in Tobago specifically. They are probably seeing it. I mean, the volume of people in Trinidad is over 1 million, so you'll probably see more of it being picked up in Trinidad. But we are certainly not picking up anything in Tobago just yet. And we have continued to do the surveillance, even though we've not been reporting. We've been doing the surveillance behind the scenes.
And that's really good to hear. In fact, had there been severe cases, I'm sure you would have known, and the hospitals would have reported cases. There's no one warded with COVID-19 cases at the Scarborough.
Not that I am aware of at this point. And if they are with COVID, that is a secondary, because, that is how we were highlighting many of the cases in the last part of when we were reporting earlier this year. The cases that we were picking up were people who were picked up because they went to the hospital because their hand was broken, and part of the protocol was to do a COVID-19 test. So it wasn't because they were going to the hospital because they had COVID, so as in the vast majority.
Or suspected of
COVID,
right.
No. So even if they are individuals, this is predicted. This is the course that viral infections take. Those of us who did public health recognized it very quickly and realize that this is a process. Of course, we are encouraging people, if you are ill and you really feel ill, like you really feel like this is not just something that you could drink some bush tea or drink some, the typical things that we do, the lime and honey and whatever, or lemon water, the things we traditionally do. If you think that this is really affecting you, and in some instances, the flu that was going around was hitting people really hard. If you think you need medical intervention, definitely seek medical intervention. But at this point, I don't think we should be too concerned, definitely not too alarmed about COVID numbers going back up. We are not seeing that evidence just yet.
All right. Now, there is a vast difference in terms of the symptoms between COVID-19 and the flu.
Well, in many instances, it's very similar, and that is why at the beginning, because it is it's a viral infection. The symptoms for viral infections are basically the same. It's just a different virus. So it is, you get the headaches, you get the body pains, you get the runny noses, you get the shortness of breath. I mean, those are that was part of the issue with COVID in the first place. When it first came about, it looked and sounded like every other flu we've had, and it was only because we had the severe cases, meaning people were getting really, really sick, and then when they tested and that kind of stuff, you realize it was something else.
What about the loss of smell? I think
yes, that was one that was differentiated.
Yeah.
And there were individual, but those were some of the more severe cases. There was also something known as COVID toes, where your toes felt funny and your toes had a funny look. Of course, there are individuals who still have what we call long COVID, because the virus affected their bodies and all of their bodies in a way that they still are trying to recover. So they may still have shortness of breath. They may still have fog and memory loss and that kind of stuff. That is all part of long COVID, which of course, that is different from the regular cold and flu experience. And of course, those individuals who had comorbidities seemed to be affected harsher by having the virus inside of them. But as I said before, the numbers that we are seeing in Trinidad and Tobago, and specifically Tobago, we are looking at the numbers, but we are not too concerned just yet. And, you know, when we stopped doing the reporting a couple months ago, many months ago. Wow, it's September
already.
Already. You know, one of the things that I said is that the reporting, the daily reporting seemed to desensitize people. So if you ever saw me coming and having a conversation about it, it's because we did see something that we needed to alert you about and you needed to be concerned about. So the fact that I did not say, this is something you need to be concerned about, means that we are looking at it in the background. But, you know, of course, be careful. If someone looks and sounds sick, definitely don't go being in their face. If you need to
we know there is a look and a sound.
Yeah, I mean, you know, somebody sneezing and coughing and running nose
sounding
and running
nasal,
eyes, sounding nasal and those things. And for those people who may be sick, we are encouraging you, whatever the illness may be, to still use a mask. If you are going to be out in public and around other people, keep washing your hands. Again, the washing of the hands is not just for COVID, because we had a time a couple months ago where we had other gastrointestinal issues because people were not washing their hands and they were dealing in food and other people were getting sick. I remember when we had that conversation back then, yes. But so we are encouraging people to still do those cleanliness type of activities. But for COVID, for right now, the evidence is not showing that we have too much of a concern just yet.
However, if persons have to travel outside of the country, what do you recommend?
If persons have to travel outside, so if you're going on a plane, and again, you do, so there are several things. You kind of have to know yourself. If you're going on a plane, you know that you have comorbidities, so your body is already not the best. You know, you're already battling the diabetes or the whatever else you are already battling, and you are going on an enclosed place like a plane, then you could and you should wear your mask, and you may actually see your air hostesses and so forth wearing their mask on the plane. It is your choice. They even encourage you to put on the mask, but it is not a mandate anywhere where you must wear the mask. And recently, well, a couple months ago, we removed even the mask mandate for the health facilities. So you don't even absolutely need to wear the mask when you're going into a hospital or a health center at this point. Of course, this does not apply to the health professionals who would have to wear their PPE depending on where they are working and what they are doing. But even that, it's really up to you to determine what you think is best for you based on your specific circumstance.
Okay, so the onus is now upon you, the individual, according to know yourself.
Yeah.
Should I not? The onus is on you. The responsibility
and of course, if you are on a plane and you notice a couple people right next to you sneezing and coughing, and you have, put on your mask, do what you need to do at that point. So you should keep walking around with it, have a look at what is happening around, but there is not a requirement, a legal requirement to wear it.
Now, I traveled home a few weeks ago from the US, and I was on this flight and there was a lady with two small children. One of them clearly had the flu, and she was coughing right through this 5.5 hour flight. Now, unfortunately, I did not have a mask. I couldn't even find anything to rub. But of course, persons kept looking around and wondering, but again, be prepared.
Be prepared, exactly.
I should have been prepared. I was not prepared. Yeah. But thank you so much. Viewers, we're going to be chatting with Dr. Faith B. Yisreal when we come back from the break this morning. And the focus is going to be on the focus this morning is going to be on the OPR Whistleblower platform. You want to hear more about this. So stay tuned and share the live, share the live, share the live.
Good morning, good morning, morning, good morning.
So you've decided to speak up because you realize staying silent will cost this country millions and you want to do your part. But you may ask, what is the OPR's role when I speak up? Well, let's see. We begin with stage 1, the handling of your complaint. First, the whistleblowing reporting officer validates and assesses the urgency and impact of the whistleblowing complaint. He or she must ensure the details of the complaint are clear. This includes information such as the dates and times, the location, if there are any witnesses, and so on. Then, the whistleblowing officer confirms the reliability of the information. Now, depending on the information given within your whistleblowing complaint, it may be forwarded to a more relevant authority, such as the Commissioner of Police or Director of Public Prosecutions. And not because you decided to speak up and make a whistleblowing complaint, should you expect the alleged person to get locked up the next day. It doesn't work like that. The OPR will be guided by due process, which takes us to stage 2, investigating your complaint. How is the complaint investigated? Within 5 working days of receipt of the complaint, the whistleblowing reporting officer will acknowledge receipt of the complaint, update the whistleblowing log, and apply a file ID to each claim. Conduct an initial assessment of the complaint to determine the next course of action. The whistleblowing reporting officer will then investigate and gather additional information. Document the findings of the investigation. Then forward the findings of the investigation to the chairman of the whistleblowing committee. Your complaint, having reached the whistleblowing committee, is now in the final stage, stage 3, concluding the investigation and findings. Upon receipt of the report from the whistleblowing reporting officer, the whistleblowing committee reviews the findings and recommendations of the investigation. The committee then reports any legal or regulatory non-compliance to the OPR board and/or relevant governmental and/or law enforcement authorities to ensure corrective action is taken where appropriate. And upon conclusion of the whistleblowing committee's review of the report, the whistleblowing reporting officer shall report the outcome of the investigation to the whistleblower in writing once the report was not made anonymously. Millions down the drain.
Viewers, welcome back this morning to the Tobago Updates Morning Show. We're still chatting this morning with Dr. Faith B. Yisreal, Secretary for the Division of Health, Wellness and Social Protection. And at this point in the program, viewers, we focus on the OPR Whistleblower platform. Dr. Faith, let's talk a little bit here about the OPR, and this is the Officer Procurement Regulation. What is the OPR's role when I do speak up?
Right. So let's step back a little bit.
Okay.
Why, yes, the whistleblower component of it is this latest part of it, but this is all part of a larger mechanism to ensure that public procurement and disposal of public property is done correctly.
Above board.
Above board, yes. Many years ago, this process started as in this. So there was a new legislation that they started with many years ago. And finally, this year is when it came into being. So it was actually enacted. It was actually, the president actually signed and say, yes, we are using this mechanism to do all public procurement. What do we mean by public procurement? Any purchasing, whether it's of a good or service, done by a public body. What is a public body? All government agencies, so we're talking about Government of Trinidad and Tobago, Tobago House of Assembly, all state entities, so all of the state boards and so forth. It includes even any entity that gets funding from a public body. So let's say the THA gives a subvention to some other entity, that they now are required to use these laws, to use these rules, to use these regulations. Rhea, honestly, it turned our lives upside down.
How so?
Because the process for purchasing anything became difficult because it was a new system, and even though the regulations were there, many of the processes to implement the regulations were not there. So, for example, last week, I think, I'm not sure who it was, had a conversation with the secretary with responsibility for education. And she spoke about the fact that even to do the school repair programs was an issue, because one of the new requirements is that all of the contractors, so all of the service providers that we use, must be in the new OPR system. It means that all of those contracts had to register with this new OPR system and must be within their system for us to be allowed to use them legally.
In other words, if they're not a part of the system or not registered on the system, they cannot be utilized.
They cannot.
There is no such thing as pulling in a relative, pulling in.
But even further than that, the Tobago House of Assembly, even before this came into being, actually had an office of the Procurement Control Office, PCO, where we had our internal THA registration process. And we actually said to the government, well, we already doing everything you said. There's already a list of contractors and suppliers and whatever. Can we simply import that list into your list? The answer was no. Everybody had to start from scratch. And every supplier, every contractor now had to go into their system to import their information and be registered using their system. We also had situations where our procurement officers at a very, for a very long time did not even have access to the system to say, well, if the contractor in their system. One of the things we also recognized, having spoken to our procurement people, legal people and so forth, is that the penalties associated with not doing, so this is where the whistleblower thing comes in as well. The penalties associated with not following the rules and the guidelines as outlined by this act were so onerous, were so high, and they now fell on the foot of the procurement officer, who is now classified as a named procurement officer. So if at health, for example, something happens, we try to procure something and is not done correctly, the procurement officer is the one who possibly had to go jail and pay $500,000 and all of that. So we had a situation within the Tobago House of Assembly when all of our procurement officers were like, hey, only a hold up.
Not going to jail for anybody.
I ain't going to jail for nobody. We're not sure what's going on. What do we have to do? Can we use this form? Things, it was, so there was an entire period where everybody was like, whoa, what is going on? Particularly since all of the pieces were not in, so the law was there, but all of the pieces were not necessarily in place to really implement the law as it was written. And this is why, again, all of the whistleblower part is important, but the context is critical. This is why in July, the said government of Trinidad and Tobago, who made this act a law in Trinidad and Tobago a couple months ago, went back to Parliament and say, Olia, this ain't working. This is not working. Let us amend it to say anything that is under $1 million, you don't have to go through that whole process, but we will make new regulations for anything that is under $1 million. the said government who put it in place went back to Parliament and say, hey, this is crippling purchasing of anything and everything. So let us go back and amend the document to say we are ignore, in essence, the whole hundreds and hundreds and hundreds of pages that we said before for anything that is less than $1 million. And we will now provide new guidelines, new regulations for things that are under $1 million. If I'm not mistaken, we're still waiting for those guidelines.
And in the meantime, while we wait, how are we moving forward with regards? How? And you made mention earlier of the fact that the secretary with responsibility for education, this was some of the challenges, these were some of the challenges faced with the reopening of schools and the inability to
do a lot of the work ahead of time. If you realize, it was maybe the last week, 2 weeks, and definitely the weekend before school opened,
that a lot of
stuff happened. And that happened primarily because what we did was say, okay, we have a special purpose company. They have a group of contractors that we know already are in the system because they were the ones who did help, helped us with BlackRock and that kind of stuff. Let us go to them through the special purpose company so that they can do the fixes that we need done.
Couldn't happen.
And that is how we were able to do all of those quick little things during the last week or so. And I thought it important that people really understood what was happening in the Tobago House of Assembly space that was preventing so much of the work that you think is normal activities. Let me even use my example at health. We actually have a situation where we have an emergency, and it was only because it was classified as an emergency, meaning the people, them children, gonna be in trouble, that we were able to fast track a process because there are provisions for emergencies in the Act. Now, this was before the amendment happened.
Right.
There are provisions for emergencies in the Act, and we could make the claim that this is an emergency that needed to be done, so we could have gone and used the regular mechanism that we were using before. Other than that, it would have been total standstill.
Okay, very quickly here, Dr. Faith, a viewer on the live is asking, what about money owed to contractors?
So the good thing about this new regulation, the monies owed to contractors will be paid if they are outstanding. Yes, we have outstanding monies owed to contractors, and those will be paid. Now, the good thing about this new regulation, though, is that part of the process for giving a contract is you have to prove that there is already money to pay for the contract.
Right.
That is one of the new things within this.
There's no question
that after the fact, we're trying to find the money after the fact.
Granted.
You have to prove that the money is already there to pay for the contract. I know that for THA, we have outstanding bills. I have come and I have met outstanding bills that we've been paying along the way. So it's a matter of balancing, though.
This is from the previous administration.
Right. Do you spend all of your money to pay old bills, or do you decide, let's pay some old bills, let's do some new stuff?
Right.
Because the other thing we would be accused of is, therefore, how much years and you ain't do nothing? Well, we ain't do nothing because we're paying old bills. So we kind of had to do this balancing act. But I know in every division, we have been looking at what bills are there, what bills come to our attention, because in many instances, I don't even know that a bill is outstanding unless somebody meet me in front of Penny Savers and say, Dr. Faith, health, oh, miss, so. And then I would come back and I would go through my officers. Let's pull up this file. Let's find this file. What's going on? And then you realize, it is sitting somewhere on somebody's desk or something and has not happened. Listen, this is a normal thing. I am so used to it that it used to anger me at first.
But it's sad that you're getting used to it, and it's sad that you're accustomed to it, and it's sad that is Tobagoans whose businesses are suffering. And the thing is, the teacher gets the blame.
Exactly.
The teacher gets the blame.
But I think my mindset on it now is thinking through what do we need to do to prevent that from happening in the future, and working out the systems within the division to prevent that from happening in the future.
All right. Well, thank you. We've got to leave it there, and I wish that we had some more time. But certainly, Dr. Faith is always ready and available to be on the Tobago Updates morning show to answer and treat with any questions and issues out there in the public domain. So thank you again for being on the program, Dr. Faith.
My pleasure.
Viewers, we're going to wrap it up there. We've got coming up after the break this morning, Sergeant Joseph Jordan, as we focus this morning on the updates from the TTPS and the TTPS on school, children, and violence. We'll get more on that just after. So share the live, share the live, share the live.